Welcome to Derm Drop's 2025 Year in Review bonus episode. I'm your host, David Sider, bringing you a quick look back at the notable developments of 2025, as well as a look ahead at what's to come in 2026. Looking back, 2025 brought us a welcome home for CSU, a bullous pemphigoid breakthrough, a couple of jack splashes for hands and hair, and a few age expansions for our pediatric patients. Looking ahead, 2026 will bring increasing indications for Zoryve and Sotyktu, more molecules including icotrokinra and povorcitinib, and AI advancements and integration. It's fun stuff as always, so let's get started. In April, Dupixent was given FDA approval for chronic spontaneous urticaria, which immediately gave dermatology clinicians who referred Xolair candidates to their allergy colleagues for in-office injection and monitoring an easy way to keep those patients in-house, as Dupixent is familiar and does not have the boxed warning baggage that Xolair comes with. In October, Novartis won FDA approval for their BTK inhibitor Rapsido, giving dermatology clinicians an oral option for CSU with rapid onset and a broad mechanism of action capable of relieving the symptoms of Xolair and Dupixent failures. In June, not long after its CSU indication, Dupixent was granted FDA approval for bullous pemphigoid. Prior to that, BP was an orphan disease without an FDA-approved therapy. In mild to moderate cases, Dupixent may be sufficient to control the disease, eliminating the need for corticosteroids altogether. In moderate to severe cases, Dupixent may be used in combination with other medications to reduce patients' cumulative exposure to corticosteroids. In July, JAK inhibitors deepened their impact in dermatology with the approval of Anzupgo for chronic hand eczema and Leqselvi for alopecia areata. As a pan-JAK inhibitor, Anzupgo offers a broader mechanism of action to match the often mixed pathology of chronic hand eczema without the potential adverse effects of topical steroids such as barrier disruption, atrophy, etc. Leqselvi is a JAK1/2 inhibitor similar to Olumiant but has a few notable differences. Clinicians have to include CYP2C9 genotype testing in the screening labs to ensure the patient is not a poor metabolizer, resulting in higher drug levels and toxicity. And patients have to take the medication twice a day, but the payoff is faster response times. July also brought an FDA age expansion for Opzelura down to 2 years old for atopic dermatitis patients. In October, Zoryve followed suit, but with a lower concentration of 0.05% for kids 2 to 5 years old. In October, Tremfya was given FDA approval for psoriasis and psoriatic arthritis patients down to 6 years old who are over 40 kilograms, giving clinicians, parents, and pediatric patients a highly efficacious treatment option with a very reassuring safety profile and less frequent injection schedule. Plus, Tremfya released data from their APEX trial showing radiographic inhibition of joint damage in June, which is a first among IL-23 inhibitors. Looking forward, 2026 will bring more indication and age expansions, starting with Sotyktu, which has a March PDUFA date for approval of psoriatic arthritis in adults, followed by another Zoryve extension into the pediatric market, this time with their 0.3% concentration for psoriasis patients down to 2 years old, expected to be approved in mid-2026. 2026 will also bring novel molecules to market, starting with the much-anticipated icotrokinra for psoriasis in early to mid-2026. Icotrokinra is an oral peptide that blocks the IL-23 receptor and will debut with favorable efficacy and safety data from its head-to-head trial against Sotyktu, giving it a considerable competitive edge in the oral psoriasis space. And if all goes as expected, there's a good chance that Incyte's JAK inhibitor povorcitinib will receive FDA approval for hidradenitis suppurativa in late 2026, giving dermatology clinicians another mechanism of action to treat this difficult disease. Finally, what would a projection for 2026 be without a discussion of AI? First, expect continued uptake of existing AI functions such as ambient scribing and prior authorization automation. Next, clinical decision support will be embedded into EMRs, and clinicians will experience a shift from AI as reference tool to AI as a proactive assistant, suggesting differentials, workup, treatment algorithms, etc. AI will also be used to calculate and track disease severity like BSA, EASY, and SALT scores for visual graphing and insurance purposes. But AI won't just infiltrate the provider side workflow. It will be rolled out in patient facing functions as well, such as scheduling, triaging, etc. As a result, there will be an increasing need for clinicians to develop data literacy skills in order to interpret and correct AI outputs. Expect to see more content along these lines in both university curricula and conference settings. The ramping up of clinician adoption and leveraging of AI in the clinic may be similar to what took place when dermoscopy gained traction in dermatology. And that wraps up DermDrop's 2025 Year in Review. DermDrop is written and hosted by me, David Sider, with distribution and administrative support by Jacob Gary. Questions and comments can be sent to us at dermdrop@gmail.com. If you had a good time and learned something useful, give us some love with a thumbs up, 5 stars, comment, or review, and be sure to tell your colleagues. Thanks for listening, and tune in again next week for more dermatology quick picks in the next episode of DermDrop.